Okay, I'm interested in your talk, and also I'm interested in adipose tissues. I'm now realized that today actually is the topic is very diverse. So I have a question for you: is there any adipose tissue sample for these patients that you have? Can we share that if you do?
We do not have adipose tissue biopsies. However, it has been discussed and been proposed, I think, by a couple of investigators, but we do not have that today. Anybody else have any questions for the speakers thus far?
Yes, please.
Yes, to Dr. Lazar, he used the term frailty. Neurological conditions are clearly defined. How is frailty defined and measured?
You have to press the red button on the side. Yep, thank you.
Do I have to keep it pressed?
No.
Okay. The question is, how is frailty measured? There are two ways to measure frailty that I'm aware of. Generally, it means slowness, weakness, and I think we all know that. What we used is the Freed scale. This was developed by Linda Freed using the cardiovascular health study some 20 years ago. It is a scale that has been used in thousands of studies. It addresses I'll use my outdoor voice. It addresses 5 different components: body wasting, shrinkage, actually strength measured by hand grip, speed of walking, and some other. Time doesn't allow me to go over the scale, but there are precise criteria. And once again, on a scale, patients are either considered non-frail, pre-frail, or frail.
Dr. Gustafson, can you speculate how adiposity actually causes dementia, which is what you implied?
So adipose tissue secretes inflammatory factors, which of course have been implicated in Alzheimer's disease. It secretes leptin, which may or may not cross the blood-brain barrier. The brain produces its own leptin. So there's a number of different factors that are produced by adipose that do cross the BBB, but in terms of the exact mechanism, that is unknown. Yeah. I think people underestimate the role of adipose tissue in the human body. I think there's a lot there that can be further explored. Yeah. Yes.
Jason, what do you mean in your abstract when you say the spinal cord is smaller in multiple sclerosis?
So I am aware of 8 different studies that have performed MRIs on patients with multiple sclerosis, and they have traced out in the manner in which we did, or I should say we traced out in the manner in which they did, the spinal cord. Most of the work is done at the level of the cervical cord. They literally trace it out and average each of the slices at that particular level. Work has also been done at the thoracic cord, and not so much as the lumbar, because I think degenerative changes are felt to impact. But one of the, and radiology of the spinal cord is not my expertise, but one of the radiographic hallmarks of multiple sclerosis is smaller spinal cord area.
Is this true of the person before the disease onset, and is it at all stages of the disease?
I don't think it is a parameter which is followed in terms of measuring disease activity, and I do not know studies that have looked at large numbers of patients and compared those that have developed MS versus those who have not. I think it simply is a characteristic that's been described in patients with MS as compared to those who are not. Again, I am not an MS expert.
Thank you for those questions.